coalition building, communication, and movement building. I'll tell you a little bit about myself and the organization that I run, and then we'll really get into details. I have a business background. I've worked both in nonprofits and also the private sector. I have a media background, a marketing background, and a branding background. And I worked for many years, starting out in the AIDS movement and then over to women's reproductive health. Then I worked at the American Cancer Society as the vice president of global advocacy for 8 years. And then now I've started a consulting firm where we focus on building up capacity for health advocates in changing policy. So our vision for Catalyst Consulting Group is a world where patients are actively involved in every aspect of health decision making. And we try to do that by understanding the patient journey, by creating meaningful ways to engage with patients and focusing on advocacy that centers on their needs. And we aim to strengthen the impact that the patient voice and can drive real and people-centered change in healthcare. We started in 2013. It's definitely a consulting firm. Initially, I was thinking of starting an NGO that would help other groups in advocacy, but we decided to go the consulting route. We have a presence in New York, Canada, the UK, and Latin America. And really, we focus on building advocacy capabilities, effective patient engagement strategies, doing research also in terms of patient journeys and patient needs. And we have over a dozen experts worldwide. So this is my passion. It's the passion of the people that we work with. We work with many nonprofits around the world. And so I'm really pleased to be here today to talk about coalition building. One of the things that I did want to emphasize for people who are listening, our chief project for Catalyst Consulting Group is an online training website called United Patients Online Academy, and you see the link here. And it's available in English, Spanish, Portuguese, and Arabic. But most importantly, and the reason I'm bringing it up here is under the area that says toolkits, you can find something that's our advocacy toolkit. That's a very easy to follow advocacy toolkit created for health NGOs as they try to change health policy. So let's get started. Our approach to advocacy is something that we call the whole society approach. And we need to recognize certain things when talking about health advocacy. First of all, health is political. Every politician, when they're running for an office, talks about health and education. And then the minute they're in office, the first thing that they start to ignore is health and education. And that's where we come in as health advocates. All health systems need improvement, and many health systems are completely broken. And I would include the American health system in the completely broken department. Healthcare delivery is very complex and usually is focused on after diagnosis. So there's very few health systems that are focused on prevention or symptoms management. So this is where health systems sort of don't really link well with patient needs and public needs. Science is also advancing much faster than health systems can stay up with. Hopefully AI will help with that, although AI could also hurt with that. So we don't really know which direction this is going to be going. And systems, because they are systems, tend not to focus on patient needs, but on what can be provided easily and economically. And again, that's where we come in to be able to advocate for patient needs specifically, and not thinking about the patients as a number or a dollar amount, but thinking about them as humans who have needs that go well beyond their own sickness. And so health systems have to amplify and extend how they address a sickness. And there is no one expert. So a doctor's not an expert, a patient's not an expert, a politician's not an expert, a researcher's not an expert. And that's where we come into needing a coalition approach. The importance of the whole society approach is that it engages different sectors of society. So from government, civil society, the private sector, patients, the media, caretakers, and the public. And this really breaks down the silos between the sectors so that we don't have like individual approaches for each one. We try to bring all of the expertise into one single approach. The whole society approach focuses on collaboration and shared responsibility for health outcomes. And I think really the key there is shared responsibility, because I think a lot of times people wash their hands of the responsibility that we have for patients once they've done their part. And so by engaging the whole society, we hope that that is done less. And the ultimate goal of the whole society approach is that it centers on equity, inclusion, and a community voice that is led by patients. In the toolkit from the United Patients Online Academy, we have broken down advocacy into 5 very simple stages. And I'm not going to go through each stage, but I do want to talk a little bit about how coalitions help in each one. So the first step is identifying the issue, identifying your advocacy issue, the issue that is the biggest problem for your patients. And where coalitions help is that they help coalesce around a joint mission to address that issue. Step 2 is developing possible solutions to fix this issue. And by working in a coalition, you create this sort of collective knowledge on how to address a solution. Oftentimes, we might only have expertise in one area or another, but when you're working in a coalition, you're going to be able to tap into different areas of expertise, different solutions, and that means that the solutions are going to be much more effective and much more complex and comprehensive. Step 3 to an advocacy campaign is building support, both internal in your organization and external into society. And coalitions help by giving access to new and varied publics to an organization as they try to implement an advocacy plan. Step 4 is the advocacy plan implementation. And this means when you have a robust coalition, you're able to have action on all sorts of different levels to be able to implement the plan. And then step 5 is evaluation. And evaluation is important for any advocacy effort, but it's something that coalitions are really very helpful in, because it's really hard to self-critique. And when working in a coalition, oftentimes you'll hear from your colleagues something that worked well that might have to change in the future. And because you have this experience working together, you might be more open to hearing those critiques. So let's quickly go through some different ways of working together that end up in a coalition. So collaboration is a clearly defined relationship between 2 or more organizations in which they agree to work together to do something that they all want. Simple. There are essentially 4 ways to collaborate. The first is networking. Networking is just keeping people informed. It could even be a WhatsApp list. The second is coordinating, where you keep people informed, but you also might make an effort to coordinate activities so that you're not duplicating efforts. The third is cooperating. Cooperating means that you're not only coordinating, but you're working with others to make sure that they might have some sort of impact on what you do. And then ultimately, we end up with coalitions, which I think anytime a group wants to start to work on an issue, an advocacy issue, they go straight to coalitions. Coalitions are by far the hardest thing to do and can often collapse under their own weight. So that's why I try to keep it as the last thing that we try to do, because they can be very complex. Coalitions involve developing and carrying out a specific project or campaign together. This means that you share decision making, you share risks, you divide up responsibilities, and you all get rewards. It's a way of sharing resources, altering activities, and exchanging information. And it is motivated by the mutual benefit and desire to achieve a common purpose. Coalitions tend to have secretariats, governing bodies, rules of engagement, and these are very, very important to have. And I'm going to go into some of those and some like best practices to make sure that we all understand how to make sure that the coalition is running effectively, equitably, and while it doesn't get too bogged down in the logistics of running a coalition. So, what are the benefits of working in a coalition for advocacy? I think everyone's heard this expression, but I really do believe it. You can go fast alone, but you can go far together. So, the first thing that the initial benefit of working in a coalition is that there is strength in numbers. You're louder and you're prouder. Coalitions amplify messages by uniting multiple organizations and individuals under a common cause. I think that's pretty obvious. But this collective power increases visibility, media attention, and political influence, making it harder for policymakers to ignore these health issues. It also working in a coalition helps fight stigma. I'll give an example. When I started out working in health, I was working in the early days of the AIDS movement, where the publics that were most affected by AIDS were gay men, transsexual men, prostitutes, and drug addicts, and people living with hemophilia. Each one of those publics was a very stigmatized public. Each one of them had their own challenges. But by bringing all of their voices together, it helped destigmatize them individually because they had the joint objective of raising awareness of HIV and HIV prevention at that point, because there was no treatment. And by working together, that helped dispel some of the stigma around their own experience in HIV. By working in a coalition, you have more diverse expertise, which means you have broader solutions. Health challenges are complex. They involve social, economic, racial, and systemic factors. By working with organizations that might have more expertise in reaching more disparate populations, you might be working with a medical society, so they have access to so much more scientific information than you might already have. These are ways of coming up with broader solutions than you could alone. A coalition brings together experts from different fields: the public health field, policy, community organizations, lived experience, as I said, medical, which allows for comprehensive, inclusive, and most important, innovative advocacy strategies. By bringing all of this expertise together, you're going to come upon a solution and a strategy that you wouldn't have been able to come onto alone in an organization. Also, coalitions are a way of resource sharing. So coalitions allow members to pool resources like funding, like communication, like people power. And this reduces the duplication of efforts and increases the overall impact and sustainability of the work. This is very important because I feel like there's oftentimes we all are very committed to our cause. And so we do the same work over and over again. It's like we work on raising awareness, we work on destigmatization, we work on reimbursement, getting access to treatment. By working in coalitions, you can pool resources so that you might not be the only organization that's doing the work, but you might be reaching more people with better solutions in that work. It allows for a unified message. So when multiple organizations speak in one voice, it shows that you have legitimacy. And this is very important. And I'll get into it in a minute. It shows that the issue matters across many sectors and communities, which shows the weight of the issue as well. And this can sway decision makers, because decision makers ultimately, if they're doing their job correctly, are responsible to their voters. And by seeing that there are more people and more organizations and more community leaders and more patients involved in something, this doesn't allow the decision maker to ignore the issue. And it's another way of attracting media, funders, and public support. Also, working in a coalition doesn't allow for distraction. I've worked both for government and also on the advocacy side. And I know that anytime I'll go in and talk to a policymaker, if I'm not very clear on my message, they use that as a way of saying, you know what, you don't even know what you're talking about. I had a group that came in here last week asking me to do something completely different. So until you guys get your house in order, I don't need to listen to you anymore. That's why working in a coalition is so important. It allows for a unified voice. And once you have a unified voice, policymakers can't use the disparate voices in your community against you. Also, coalitions allow for community engagement and access to varied communication vehicles. Coalitions help ensure that advocacy isn't top down, that it's not one big organization with a president and a vice president that care about the issue, telling people what to do. By being in a coalition, you provide a structure for grassroots voices to be heard, to be prioritized. This will make health advocacy more equitable, more culturally relevant, and more grounded in real patient needs. The other thing to think about in the age of social media and all of these different platforms that we have access to, a coalition gives you access to a wide variety of communication vehicles that your organization singularly might not have been allowed to access individually. So think about this as a way of building up from the grassroots, but also out by using everyone in the coalition's abilities in terms of communication. All right, quick 5-step checklist for creating an effective coalition built on many years of having done it incorrectly. My goal in life is to make sure that all the mistakes I have made aren't made again. So let's get that started. All right, the first step is to focus on a shared goal. Okay, seems pretty obvious, but it can get pretty complex. Don't let the coalition become one group's pet project. Sometimes, if there's a particularly large organization in a coalition, it really gets driven by their agenda. Everyone should feel ownership, not like they're just helping somebody else's campaign. It might be that you have a really big organization leading it, and then you have great social media presence, and they're really only using you to get their name out there on their pet project into their social media and to your social media platforms. And this is just a waste of everybody's time. Another problem is trying to tackle every group's separate issues at once. This is a recipe for chaos. I'll give you an example. I worked in a coalition that was for diagnosing breast cancer early. So it was about early detection. So we were really focusing on access to mammography, training primary care physicians, very, very specific to diagnosing breast cancer early. One of the groups was a general breast cancer group, right? Their focus on breast cancer was from A to Z, right? From early detection to palliation. And they really, really wanted us to include in the work of the coalition services or awareness around services for women with metastatic breast cancer. Not to say that women with metastatic breast cancer do not have enormous needs. The issue is it was not relevant for the mission of this coalition. We could have helped in other ways by networking or collaborating in other ways, but for this coalition, women with metastatic breast cancer already hadn't benefited from early detection. So they were no longer part of our mission and no longer part of our public. And we had to be very, very strict about that. So the important thing is to stick to issues that everyone agrees on, and that's where the real progress happens. Be real about power and participation. And I think this is something that all coalitions suffer from. This idea of one group, one vote only works if everyone is really doing the same amount of work. Many times, once coalitions get to be 30 or 40 or 50 groups, There are groups that are really only there to lend their logo or to be a resource if you need to speak to a specific policymaker or access a specific community. They might not be as engaged as the top 3 or 4 groups that are running the coalition. So come up with a way where decisions are going to be made, where people feel like it's equitable, but the people who are doing the majority of the work don't get hijacked by groups that might not be as engaged, might be very committed to the issue, but might not be the right ones to make the major decisions. If a few of the big organizations are carrying the most weight, their opinions matter more, and that's okay. I feel like we have to just let that go, because so many times the smaller groups resent that. But I'll tell you, sometimes the bigger groups resent that they have to do all of the work. So both of us have to, both sides of that equation have to let up a little bit on that control. And it is fine if some groups sit out certain actions if they're not on board. No guilt trips. Sometimes a coalition might want to do something that's a little bit more activist oriented that a group might not be comfortable with, or might be more confrontational with a political party that a group might not be comfortable with. That's fine. You don't need to get engaged on that activity, and that's perfectly okay, and we understand why. 3, and most importantly, set clear ground rules. Agree early on how decisions are made, what your governance structure is going to be, how funding is going to be used, and who is going to raise the funding, and where the funding is going to go, and who approves of that. And everyone should be clear on the expectations and who is doing what. It should never be a situation where you are surprised by something that's happening because of not the communication systems weren't working or the decision-making systems weren't working. Also, and this is something that I have seen happen with a lot of coalitions, please, please, please encourage consistent participation and at a senior level. Oftentimes you find that coalitions, what happens is that groups start petering off in terms of participation. You know, they come to one meeting and then 3 months later they come to the next meeting and they disagree with what you've done in the last 3 months, right? But that's because they haven't been there. Or you have someone very senior involved in the coalition and they send their deputy or their coordinator or their assistant to the meetings, which means you're actually not benefiting from the expertise that the senior level individual could have provided. And so this is something that I'm very committed to: consistency and the same person at the highest level of seniority as possible. And let's recognize that everyone brings something different. Some people are great, some groups are great at turning people out. So if you're doing a campaign and you need people on the streets or letters signed and sent or online advocacy campaigns, some groups are really good at that. Other groups are really good at data. That's fine. You need both. So make sure that you aren't expecting the data group to be the activist advocate and the activist advocate to be expert in data collection. Use each group's strengths to your advantage, because that's the whole point of teaming up. So oftentimes when I start a coalition, we go through what we call our asset map. We have every group detail what they think they can bring to the coalition. And then we see what we have in terms of assets, and then we can divide up the work. Health organizations are often competing for the same funding, so be mindful about who gets credit and how that credit affects relationships. Sometimes coalitions can take money away from some organizations, so we have to make sure that everyone is getting what they need out of participating in a coalition without cannibalizing their own budget. Share the credit, but keep the coalition in the spotlight. You want to make sure that there's not one group that's recognized as being the leader of the coalition. The coalition itself should get most of the public credit, or else it looks like it's a one organization show. After that, You can fairly share the media roles and the recognition based on how much each group is contributing. So try not to have the same groups in front of the media all the time. Try not to have one group speak for the whole coalition in front of policymakers all of the time. You want to make it very clear that it is a collaborative effort and that there are a lot of organizations involved and a lot of different expertise being offered. Now I'm going to go through just a quick list of complaints I have after 20 years of working in coalitions. These are my pet peeves, and I'm sure you will recognize every one of them. The first one is having to agree on literally everything. How many times do we need to have to discuss, should we use Google Docs or Word? It will be week one, and you will still not have any consensus after 47 emails. The picking the name game, picking a name that reflects the mission without sounding like a 2003 rock band. I made one of the biggest picking the name game mistakes in a breast cancer coalition that I founded years ago in Latin America. I thought the name Latina Mama sounded good. Latina means woman, mama means breast. There we are. It's a women's breast cancer coalition. I looked it up on Google. I looked it up on Google Mexico. I looked it up on Google Brazil. No one had taken the name. I wanted to take it. Then in Peru, we learned the hard way that Latina Mama was also the name of a pornographic website. So this naming the game can be a big challenge and can take up a lot of time. So try to make it as quick and easy as you can. Meeting mayhem. Scheduling a meeting where everyone is free at the same time basically means that you have to find a new way of time travel. You want to be able to have a quorum, and you want to know what a quorum is before you start setting up meetings. So you're not going to have everyone on the phone at the same time. You're not going to have everyone in the meeting at the same time. You have to agree to that. You have to understand that that's what's going to happen every once in a while, and not just keep sending around invites for people to decline. Email overload. Nothing screams productive coalition like 17 reply all emails that say, thanks, noted, please. It keeps them emails to a minimum. Different vibes, same Zoom. You have too many different views in a coalition. One organization wants a revolution, the other one wants to make incremental change, and then the third organization just wants to talk about the font on a flyer. Try to create expectations for all that variety of partners that you're going to be working with on what you're going to be doing, how you're going to be doing it, and how extensive their role is going to be. Who's in charge? We're all equals here. Being equals, having too many equals in a room means chaos. You should always choose a leader, a leadership structure that people agree on. It needs to be voted on, and that allows for a less chaotic environment. The funding tango. Everyone is broke, but someone might have a grant that they heard about something somewhere. Remember, you need funding. You need to be very clear about funding. Don't play around on that issue. Make that a priority early on in creating a coalition. Agenda anarchy. Please, please, please have every coalition meeting with a very clear agenda. And the agenda shouldn't be 10 minutes of updates from each coalition meeting, 45 minutes of tangents of things that they all have confronted over the last month, 5 minutes of like some really frantic active decision making, and then ultimately no one remembers what was decided. Clear agenda with time limits and minutes from the meeting. This is very key to making sure that you have a sustainable coalition. And then ultimately, and we all know this, the great Google Drive mystery. There are always 14 different Google Docs that say coalition docs, and no one remembers which the last version is. And as a hint, final V3 Google Docs is not the last version. So please make sure that when you're pulling all these groups together into one online Google environment, it's very clear where things are housed, where the most recent documents are, because that can end up messing up a lot of time and a lot of joint effort. So, in closing, I just want you to end with a very beautiful quote from anthropologist Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. So don't doubt that you can make huge changes. You can make huge changes individually, but you can make larger changes in a collaborative coalition environment. The importance of coalitions cannot be underscored, but it is a very complicated process. But it does allow an advocacy organization to have more access to policymakers, to scientific experts, to patients, to caretakers, and to the media in order to have more impact for our ultimate goal, which is helping patients access treatment, preventative services, accurate diagnosis, and quality of life as they are challenged by a disease. So that's it from my end. Again, my name is Alessandra Durstine. This is my email. And also, please remember to visit unitedpatientsacademy.org. We have a lot of resources there for advocacy organizations. It's absolutely free. It's available in Spanish, Portuguese, English, and Arabic. And it was a pleasure to create. It's been a pleasure to talk to all of you. We often engage with patient groups on capacity building. So if at any time you may have the need for my expertise or expertise from someone from my team to work with one of your groups to help you move an advocacy agenda forward, you have my email here, adursine@ccgintl.org. Thank you so much for your attention and good luck.